welcome to DermaClinix Groundbreakers in association with CNN News18, and I'm your host Ruchira Sharma. This is a special show that will focus on medical ingenuity, transformative aesthetics and stories of hope and resilience. Through the day, we will focus on groundbreaking innovation in the field of trichology. The hair transplant industry in the country has experienced a remarkable growth, specifically in the recent years. India performs more than 350,000 hair transplant surgeries annually. So how is this space really evolving? What are the opportunities and what are the challenges? And what does the future of transformative aesthetic really look like? So to find out more about that, I am joined by two very special gentlemen, luminaries who have been transforming lives with their groundworking work in the field of hair transplant. So let's welcome Dr. Kavish Chouhan and Dr. Amrendra Kumar. Welcome to the show. Well, you both are visionary co-founders with more than 15 years of experience, and you have transformed lives, you have changed the game for so many people who are suffering due to hair loss. So Dr. Amrendra, let me begin with you. Could you explain to our audience what exactly is hair transplant? It has been a game changer for so many people, but could you explain what does it entail?
So, usually when the baldness happens, people used to lose their hair on the top of the skull. Usually it involves the frontal, the back area as well, and gradually the hair becomes thinner, shorter, and then they disappear. If the baldness grade is becoming higher, then medical therapy alone is not sufficient to restore hair. And in those conditions, we do hair transplantation, and basically we have two types of hair, one that disappears with time, and there is another set of hairs which is usually distributed on the back side and on the lower side of the scalp, which is usually resistant to this process of hair loss. So we take out some of the hair from this area and implant in the bald area in such a way that after they grow, they should cover that area and they should look natural as well. This is what we call hair transplantation. Now there are many techniques about that. There was older technique like FUT, and then there were certain shortcomings in that technique which improved with FUE, and now people wanted to remain discreet about their hair transplantation. They want lesser downtime. They don't want to
disrupt. Because there's a stigma attached to the whole process.
Kind of that. So with that, there is now evolution of long hair transplantation.
All right. So I wanted to come to you about, like he mentioned, there's this incredible innovation in the space of hair transplant, which is FUE, long hair transplant. So could you really sum it up for our audience?
Yeah, so now we have this technique called Instagraft or instant long hair FUE transplant. Now, people who don't want any downtime or don't want any kind of knowledge that other people should know that they have underwent a hair transplant. So in this, we can take out the hairs with its entire shaft length intact from the back, and we can plant it in the front, giving them an instant transformation. And at the same time, the donor area looks completely normal. And now with our innovative techniques, it's possible to achieve 30 to 50% of the grafts growing directly in the growth phase. So the long hairs which we are planting with their entire shaft intact, and those also grows immediately. So that allows them to have an immediate transformation.
All right. Thank you for that, Dr. Kavish. But coming to my next question, could you share with our audience the inspiration behind this revolutionary long hair FUE or long hair transplant? What is the primary inspiration for you?
See, the inspiration for us, we want to make the hair transplant more accessible to everyone. Now, our lifestyle is getting more and more busy. No one wants to have any downtime. We just want to continue with our lifestyle. So previously, with the typical hair transplant, there was a downtime of few weeks. Most of the people who have a very busy schedule, celebrities and VIPs, they have difficulty in having that downtime. But with this instant long hair transplant, this Instagraft technique, this allows even people with extensively busy schedule to undergo hair transplant without others knowing it. So it can be done in such a way that neither in the donor area nor in the recipient area, there is no evidence that a transplant was done and people achieve an instant transformation.
And that must be a big relief for all the people.
Sure. And especially even like in female cases, of course, trimming the hairs is going to be a big issue. So it's a big boon for that population and others who don't want any downtime.
All right. So coming to you, Dr. Amrendra, as Dr. Kavish said, of course, no shaving, no trimming, and instant results are the primary advantages. But could you take us through the other advantages of FUE hair transplant method?
So apart from no trimming, no shaving in the donor as well as in the recipient area, here the hairs are actually transferred very quickly. The outside body time of the hair remain very less, so their survival rate improves a lot. Along with that, in DermaClinix, we actually follow no touch to root technique, where the roots are not damaged at all during this procedure. That makes hair survival rate of the graft much better. Along with that, we also have our innovative hair root revival technique, which actually enables these hairs to grow directly.
All right. Thank you for sharing those insights. Coming to you, baldness is a concern that affects men and women, and in fact, interestingly, you won't see as many women really going for this treatment due to various concerns. So, what is the innovation here, and what are your thoughts? How are you really helping women seeking this kind of a hair transplant method?
Yes. So, talking about female hair loss, in most of the cases with female, in many of them the hairline tends to remain intact. So, in most of them we prefer to do medical treatment first, but because of the shaving part, most of the females were reluctant to go for hair transplant previously, but now with this long hair FUE technique, they don't need to do trimming at all. And because of that, now many more females are opting for hair transplant, and it's going to be a big boon, especially for female hair transplant.
So, Dr. Kavish, you've taken us through the whole narrative of what the process is and what the procedure are, but just coming to a very popular quote that winners don't do different things, they do things differently. So, as a pioneer in the space, could you tell us what are really you doing differently?
We were the first one to publish papers on using the non-scalp hairs. We have the first publication on comparing the scalp, beard and chest grafts, and now especially in the last 5 to 10 years, non-scalp hairs from beard and body are more extensively being used for hair restoration. We started this concept of utilizing simultaneous transplantation and the hair root revival technique, as Dr. Amrendra mentioned, to use it more efficiently in hair transplant. Not only that, we have started, or we are the pioneers of body hair transplant in vitiligo. Vitiligo or leukoderma is one of the diseases which widely affects many people and holds a lot of stigma, but with hair transplant we achieve remarkable results even in those cases.
All right. So, taking from what Dr. Kavish said, Dr. Amrendra, if I were to ask you in one sentence, what does DermaClinic really do differently? What would you say?
So, at DermaClinix, we not only do the surgical in a more scientific way, we also take precaution of all the safety and precautions while doing the surgery to keep our patient very safe and comfortable. We have regularly seen many bossed up kind of surgery. Here we actually regularly recorrect those surgeries as well, and we take almost all the precautions so that patient can have very natural result and they can have a very good quality of the coverage. They get very good quality of coverage as well with hair transplantation.
All right. So, Dr. Kavish, you have touched so many lives, you have transformed them at multiple levels, and you've rekindled spirits, so to say. So, if I were to ask you to share a success story that really impacted you or affected you at a very deep level, which one would that be?
Yeah, so for that I would choose transformation of an acid burn scar victim by doing hair transplant. She was an unfortunate victim of acid burn, and because of that she was in depression, she had lost all her hopes, but with a successful transformation we did 2 sessions of transplant, eyebrow transplant, scalp micropigmentation, fractional laser resurfacing, rejuvenation with PRP. But with all this plethora of techniques over 2 years, we were able to significantly transform her, and that brings me a deep level of satisfaction in achieving that. And now this allows us to transform people even in such situation and help them and bring their confidence back. That really boost our confidence.
Definitely. You are definitely pioneers in the space, and you're making a huge difference to so many people's lives. But on that note, we'll slip into a short break, but don't go anywhere, as we will find out about other hair transplant techniques from the co-founders of DermaClinic on the other side. So, stay tuned. Welcome back. You're watching DermaClinix Groundbreakers, pioneering long hair FUE in the world in association with CNN News 18. On this special show, I am in conversation with the co-founders of DermaClinic, Dr. Kavish Chouhan and Dr. Amrendra Kumar. So coming to you, imagine there's this person living their normal life, hustling to realize their dreams and hopes, and also nurturing their personal relationships, and then one day their future is burned to ashes. It is so difficult to imagine the mental state or the trauma of an acid attack, a victim or a burn survivor. So Dr. Kavish, how does DermaClinic really navigate these complexities for such victims, and how are you really empowering them and enabling them?
So over the last decade, we have really mastered the art of doing hair transplant in the scar victims, and in many of the cases of secondary cicatricial alopecia, where the damage is because of burns, electrocution injury or trauma or acid burn, in them with hair transplant it's possible to completely transform them with hair transplant, and we are able to bring back the natural hairline. And now to take it to the next level, through our association FUE Asia, we have started an Operation Hope, where we are starting a Asia-wide registry of these cases, and we are incorporating hair transplant surgeons across Asia who can do charitable hair transplants for such victims, and so that we can transform more lives. At DermaClinix, we have been doing charitable transplant for acid burn victims for the last decade, and we have helped transform many lives, but now we want to do it across Asia so that we can touch even more lives.
All right. So you spoke about this humanitarian mission, Operation Hope, which is initiated by DermaClinic. So could you tell us a little more about how are you really impacting people, and what is the main mission of rehabilitating burn and acid attack survivors here?
What we are trying to do is, we are starting a Asia-wide contact number which people would be able to reach out to and reach to us if they need it, and so that they can be notified and they can be transferred to the nearest place where these surgeries can be performed. Many a times it may not be possible. So for example, if someone is having this problem in Myanmar or Kazakhstan or in Korea, so we should be able to give them a surgeon which is in their country, and so that they can reach out and they can get the surgeries transformed, because it's not only one trip. They would require more times to go to the clinic and require the transformation, but we want to help them in this state. So they already have suffered, but we want to help them in making it better in future.
And as you were telling me earlier, India has really emerged as a top destination, as a big medical tourism hub. So how is that really changing?
One of the things is that you get here top-notch quality of medical facilities, good quality of doctors, plus we have also some cultural value as well. We had ancient system of medicine which teaches us about healing and all those things. India is also a destination where there is people can easily travel. They can have at those kind of services which are very costly at the West. You can get it in India at a very affordable rate actually.
Great. Thank you. Thank you for sharing those insights. Coming to you, Dr. Kavish, this is one of my last questions, and I'd love for you to answer what are the future advancements that one can expect from this field of trichology and hair transplant, and how do you envision it further changing lives, especially at DermaClinic?
DermaClinics, we try to bring all the recent innovations and advancements in the field of dermatology, aesthetics, as well as hair transplant to India first. And in that regards, we also are innovating many of the different fields in aesthetics, even for non-surgical methods, and even for there are many of the issues which people they face difficulty in discussing them. Like one of the issues is many of the females, they face stress urinary incontinence after childbirth, and nowadays we have an advanced method to treat it non-surgically, and we can correct stress urinary incontinence, and even for aesthetic purpose the females can transform themselves by using non-surgical method and be more confident of themselves. And similarly for aesthetic procedures also, there are many of the non-surgical modalities which are very less invasive or non-invasive, and which can completely transform their looks way more efficiently.
Definitely. Coming to you, Dr. Amrendra, you have been redefining global hair practices. So what are your expectations for the coming years?
So I am expecting that in coming years there will be advancement in the technology which is going to reduce the downtime, which is going to improve the quality, as well as the patient will be more comfortable after the transplantation. And innovation will always go on. Now there are development of robotics, use of robotics in hair transplantation, then use of artificial intelligence.
And that's also transforming the whole space.
So we are waiting for that. If those techniques, those technology which we are developing is very much is beneficial for a common people, then definitely we are going to have that.
There is a social dichotomy, you know, when it comes to hair transplants, because they are actually perceived as a cosmetic procedure rather than essential medical care, but it has a life-altering impact. So how are you really tackling this misconception at DermaClinic?
So people think that hair transplantation is only an aesthetic procedure, but the impact of baldness on a person can be profound actually. There are many patients who suffer with depression, anxiety, because they are very much aware of their look. Their confidence shatters actually when they get bald, and there are other social stigmas also associated with the baldness, as Dr. Kavish has mentioned. Then there are acid burn victims. There are many cases of scarring alopecia. Patient got burned, patient got accident, and they lose hair, and that actually affects their external appearance. And nowadays people are very much aware of that. So not only psychological impact, there are other things as well. People often go to there are many surgeries done by the people who are not qualified to do those surgeries. The outcome is not that great. People invest their money, time and hope as well in those kind of procedure, and they don't get that kind of result. So according to me, if I am doing hair transplantation, I am changing their appearance in a good way. That not only helps to patient to gain their confidence, they actually helps to move on there in their life actually.
All right. So Dr. Kavish, coming to you, the FUE Asia organized by DermaClinic is a notable event in the hair transplant community. So could you really share with us the objectives and the impact that it has been having in uniting hair transplant surgeons from across the world?
As the world is becoming more closer and closer, so we should be able to share our techniques everywhere. So innovations are around us. We should embrace them, and only through collaboration we can make it better. You know, so the competition is always at the top. The people who are the competition is always at the lower level. People who are at the top, they always collaborate, and that's what we want across the world. So hair transplant surgeons from across the world, they gather and bring up their ideas, and they innovate, and they also help to train the youngsters in getting themselves trained much more efficiently and becoming the best version of the hair transplant surgeons which they can be.
All right. So just before we wrap up, one last question. You were speaking about a transgender which really touched your heart, you know. So could you tell me how DermaClinic is ensuring inclusivity when it comes to hair transplant procedure, especially for the transgender community?
Yes, so we for us, every patient is similar, and we want to give them whatever best they desire. Now, many of these transgender patients are affected significantly in their life because of the biases which are surrounding them, but we want to make feel themselves good about them. And for that, there are many who have kind of a masculine hairline, but they want a feminine hairline, or vice versa. So we want to help them transform, and we had patients who have shared their stories in the social media and how their life got transformed with this, and we are really fortunate that we are able to do so.
All right. So just before we wrap up, in a single sentence, if both of you could tell me that for patients who are actually thinking of undergoing hair transplant, what is your advice, or what is the strategy that they should keep in mind?
So first, the patient should know what is the qualification of the doctor. If they are searching for a hair transplantation surgeon, they should also know about the qualification of the doctor. Plus, the center should be, whatever the center they are choosing, should be equipped with the every safety instruments. They should follow all the protocols and guidelines laid by the governing body of the hair transplantation, and they should follow all those things. So that is very much important to be in a safe side.
All right. What about you in a single sentence?
Yes, so one thing is that in most of the countries, though hair transplant is only allowed to be done by qualified dermatologists and plastic surgeons, our medical councils also are giving similar guidelines. So make sure that you go to the right surgeon and the right center, because safety is paramount in this. So always be sure about that.
All right. Thank you, gentlemen, for sharing your insights. You both have not just been transforming scalps, but also infusing confidence and redefining aesthetic medicine on a global stage. So thank you for sharing your insights with us, and thank you for sharing it with the audience.